Hi, I'm Kat Navarro-Lee with the B Foundation for Brain Aneurysm Prevention, and I'm here with neurosurgeon Dr. Jeffrey Colby. Dr. Colby, thank you so much for being here with us. So one of my passions as an awareness ambassador for the B Foundation and also as a brain aneurysm survivor is really being able to help tell stories that can inspire and educate and empower people in our community. So I thought it would be really helpful to have this conversation with you since you are my neurosurgeon. And I thought it would be a good chance to see if I could pick your brain about some wisdom and some things about brain aneurysm prevention. And just because you're such a central part of my story, having had, an unruptured brain aneurysm that is now healed, which is, I know, not the most common story. Most of the ambassadors that I know, they found their aneurysm after the rupture. So I'm just so thankful to have, the success that we did with my procedure. And I'm so thankful to you for being part of my story. So as we talk about brain aneurysm prevention, before really getting into it, I'd love to just kind of have people get to know you a little bit better. So if I could just ask you why you decided to become a neurosurgeon.
Well, I'd just like to, thank you for having me here, and I'm happy to have a discussion with you. And it's a great question. So when I entered medical school, or when I was actually applying for medical school, I didn't even know what a neurosurgeon was really. I had no role models who were surgeons at all. I had no contact with any neurosurgeons. It was a job and a lifestyle and a calling that I just knew nothing about. And I thought I was going to do something else in a medical field. But when I entered medical school, one of the big classes of the first year was human anatomy, and I just really fell in love with that. I really liked learning about how the body worked and doing the dissections that we were supposed to do and really doing those with precision. And that kind of drew me towards the field of surgery. And it wasn't until I then dove into neuroscience research for my PhD that I combined the love of surgery with the love of neuroscience, and that steered me towards neurosurgery. And ever since making that decision, I haven't looked back.
Wow, and here you are, one of the best doctors in the field. I have to say that one of the reasons why, before I got my procedure, I did some research and met with, several other doctors, and I feel like you gave me like the most specific response, and I just felt really comfortable with you. So I think that's why a lot of patients have been really happy with having you as their doctor.
Well, thank you for the kind words. I would say, the most important role that I have, other than, the hands-on part of a procedure, is doing what you exactly just described, and that's providing information. And I think information is very powerful for a patient, and as a patient, you have the right to know what's going on with your body and what the options are, and ultimately, hopefully, what your doctor tells you empowers you to make a decision that you feel is right for yourself.
Yes, I feel like that's so important. And as we're talking about research and just brain aneurysm prevention, how do you feel that the trajectory of that has changed over the years?
Well, as you know, and the B Foundation is very aware. Aneurysms are, no pun intended, on the minds of a lot of us, in this field. And there's been lots of research over the years as far as why certain people get aneurysms, what are the risk factors, and we kind of break those into what we call modifiable and non-modifiable risk factors, meaning the things that we can control and then the things that we might not be able to control as well because they're based on our genetics. So we're trying to understand why people get aneurysms. We're trying to be better about diagnosing them with imaging studies. We're trying to be better about interpreting those imaging studies to understand, what aneurysms are risky and what aneurysms are maybe not so risky. And that's where a lot of the research comes into play. And it can be everything from genetics research to interventions just to try to improve people's overall health and deal with things like hypertension. And then there's very sophisticated computer modeling about how the blood flows in vessels and how that may lead to aneurysms. So there's a lot of cool stuff going on, and and research continues, and there's just more and more interest as time goes on.
Yeah, I mean, there's so much information. And what I was going to ask, which basically kind of ties into what you were saying, is how you think things are going to be in the future as far as prevention, like what's on the horizon for that. And it seems like there's already so many things now that weren't available even just a few years ago.
Yeah, so the field is moving towards more sophisticated imaging. Some of this imaging will be done non-invasively, and some of this imaging will be done what we would call invasively, kind of with angiography. So I think identification, particularly identifying patients at risk earlier, finding aneurysms before they break and better understanding them. And then, you can even talk about prevention. You can talk about prevention in regards to those sorts of things, meaning trying to prevent aneurysms from forming. And then there's the other aspect of prevention, which is once an aneurysm is found, preventing it from breaking, which is the whole treatment paradigm. And there's all sorts of new tools and new technologies that are coming in the works, which I will each year we'll probably have something new with regards to aneurysms and a different type of tool that we can use to treat them.
Yes, it's so fascinating because even with my procedure, right, it was, having to we went through with a catheter, right? And so when I tell people about that, about how it was non-invasive, they didn't have to cut my head open, people are absolutely astounded. Where I feel like this procedure wouldn't have been available to me if I even knew about it maybe 10 years ago. So I'm just so grateful to be here in this time where those kind of things are available.
Yeah, very true. The field is rapidly changing, and I think it's rapidly changing for the better. There's a lot of intellectual power going into making these treatments safer and more readily available to people.
Yes, that's very encouraging. What have you seen as the biggest struggles for your patients, whether it's, unruptured or ruptured with their brain aneurysms? What has been the biggest struggle in their recovery and moving forward?
Yeah, that's a really important question, and I think those two groups, meaning those two groups of patients, are very different, very very different. Um, Patients with unruptured aneurysms who presumably know they have an aneurysm, um, the things that I see are most difficult for that specific type of patient are just number one, dealing with the diagnosis, understanding the diagnosis, dealing with the likely stress and anxiety that comes with that diagnosis. And I think that for some people is very very challenging. They have to kind of come to grips with the fact that there's something on a blood vessel that can cause a problem and that it's very unpredictable when or if it's going to cause a problem, and then having to talk with people and understand how to manage that problem. And Patients, not every patient is the same, as and some people that's a real big stressor on their life, and they can't move forward until they have a better understanding of it, or maybe that they get their aneurysm treated. Other patients are maybe have a little less anxiety about the situation, but I think most patients who are diagnosed with an aneurysm, that winds up being a major stressor for them. Patients that have had an aneurysm rupture, that's a very different type of person, or I should say, they're oftentimes dealing with very different types of problems.
Hmm.
If they were able to get through the rupture event and the treatment of the aneurysm, relatively unscathed, I'd put that person in the lucky category.
Yeah.
And we're probably very thankful that they got through, that event without major issues. But more commonly, there are neurological problems, and there are cognitive problems that come along with a brain rupture, and those patients are struggling to deal with those things. There could be um, cognitive issues. There can be physical disabilities, and those patients really are trying to cope with what their new normal is, and trying to grasp and figure out anything they can do to help them improve and to help them get function back and try to get as close back to their previous life as they can. But it can be really really challenging, and I think organizations such as the B Foundation as well as other organizations and support groups, around the country that are focused on aneurysm patients, can be a real a real positive thing, to help bring these patients together and to help them understand what they have and their problems, and help them get the support and the tools they need for recovery.
Yes, and I know you help with the UCLA support group, and so it's so nice to be able to see that.
Well, thank you. From the moment I joined UCLA, one of my interests was to get a group together of aneurysm patients, and really it doesn't have to be limited to aneurysm patients, but patients that deal with blood vessel problems of the head, and get a group of patients together and host a support group, and it's one of the best things I do. And we do it every quarter. We'll have a call where we get patients together, and it's really just refreshing to hear from the patients and to connect the patients to one another, and for patients to know that they're not alone. There's lots of people out there with aneurysms, ruptured and unruptured, and just providing a forum for patients to talk to one another and learn from one another. It's really it's a very important part.
Yes, I do think that that community aspect is so empowering where we can share stories and really help build each other up. And I think that it helps people know how to move forward, which brings me to my next question of just really wondering what your advice would be for patients, for caregivers, for those in the community to best advocate for themselves.
Yeah, another great question. I would say the best piece of advice is, educate yourself, right? Educate yourself about the diagnosis, educate yourself about aneurysms, educate yourself about what your options are. And that doesn't mean you have to do all the work yourself. Seek experts, seek reputable institutions and reputable physicians, and people that will hopefully provide you with that information that you need to know. But I think knowledge is power, and each individual, they may want different things for their body, and different choices that they make for themselves, but you need to start with the knowledge and start with the education. I think the other piece of advice is, there's comfort in numbers. Aneurysms are a lot more common than I think most people around the country realize. The numbers of 1 to 50 or 1 to 100 people having a brain aneurysm, that's actually a pretty common diagnosis. It's just a lot of people don't know they have them. And
Right.
I think there is power in numbers, and knowing that you're not alone, and there's other people going through the same things that you're going through as an aneurysm patient, and there should be some strength in numbers there.
Yes, which is why we're doing this, because I really feel that, what you have to say and that information can be so helpful for so many people out there. So thank you so much for doing this. And I'm just so excited to be able to help inspire others by having you come and chat with us. Thank you, Dr. Colby.
Well, the pleasure's all mine, and thank you so much for hosting this. It's a true honor to talk with you today, and to be a part of the B Foundation's mission. The pleasure's all on my side.
Thank you. We hope to see you at the gala soon.
Thank you.